Hello everyone, today we'll be discussing on the topic classical psychoanalysis given by Sigmund Freud. So, we'll be covering on introduction to Freud's psychoanalysis, core concepts in psychoanalysis, goals of Freud's psychoanalysis therapy, process involved in Freud's psychoanalysis therapy, and techniques of Freud's psychoanalysis therapy. Coming on to introduction, psychoanalysis is a therapeutic approach developed by Sigmund Freud in 1917, focusing on the unconscious mind's influence on behavior. So, the concept of Freud's psychoanalytic therapy provide a basic frame of reference for understanding not only his work but also that of other psychoanalytic theorists. In psychoanalysis, the term instincts and drives are often used interchangeably, but the term drive is more common. Originally, Freud distinguished between self-preservative drives like including breathing, eating, drinking, excreting, that is basic need that a human needs, and species preservative drives, that is sexuality. The psychic energy that Freud is terming as libido. So when he was in 60s, Freud put forth the idea of a death instinct that accounted for aggressive drive. These include unconscious drive to hurt others or oneself. Often, conflict arises between the life instincts, eros, and the death instincts, thanatos. So, he is described three levels of conscious. One is conscious, preconscious, and unconscious, wherein the main focus of Freud analysis theory is bringing unconscious material into conscious one, where it is the very biggest approach wherein Freud has given all of us. There are a lot of times we find difficult, and due to a lot of emergency situations or trauma, conflicts, we would have abandoned certain emotions, thoughts, behaviors, lot of things which have unconscious. So without our knowledge, without the individual's knowledge, we keep on exhibiting the thoughts like overthinking or exhibiting the behavior which is not ours, but we always have a confusion like why are we behaving like this, or why are we overthinking. So which is the residuals of the unconscious thoughts based on the situations which we have embedded inside. This analysis helps us to bring that unconscious thoughts, emotions, thinking, everything into conscious, so that there will be a drastic change later. Core concepts: structure of personality, id. At birth, the infant is all id. Inherited and physiological forces such as hunger, thirst, and elimination drive the infant. There is no conscious awareness, only unconscious behavior. The means of operation for the id is pleasure principle. Ego. The ego must mediate between the world around the infant and the instinct or the drives within the infant. By waiting or suspending the pleasure principle, the ego follows the reality principle. For example, a young child learns to ask for food rather than to cry immediately when her needs are not met. Another structure of personality here is superego. Whereas the id and ego are aspects of the individual, the superego represents parental values and more broadly societal standards. As the child incorporates the parents' values, the ego ideal is formed. It represents behaviors that parents approve of, whereas the conscience refers to behavior disapproved of by parents. Psychostages of development. So, Freud believed that early childhood experiences would share the personality, where oral stage focusing on oral principle, that is, in this oral psychosexual developmental stage, where the infant or the participant or the client or the individual should have the proper oral training, like the child should be able to eat and oral activities related to mouth region. Anal, control over bladder and bowel movements. Phallic, Oedipus complex emerges. Latency, sexual impulses are repressed. Genital, mature sexual development. Defense mechanism. So in this, Freud identified unconscious strategies to manage conflicts: repression, block painful memories for consciousness; denial, refusing to acknowledge unpleasant realities; projection, attributing one's own unacceptable feelings to others; displacement, redirecting emotion to a safer target, sublimation, channeling unacceptable impulses into an acceptable activities. Goals. We are moving on to therapeutic part of Freud analysis, how best we'll be able to use the Freud which he has given us to overcome certain disturbances or challenges which the individual is going through. That is, one of it is bringing repressed material into consciousness, resolving childhood conflicts to reduce distress, long-term process aimed at personal growth. So this is the physical setting of the Freud psychoanalysis, where this setup is believed to facilitate free association, allowing the patient to speak freely without immediate reaction or perceived judgment from the therapist. The absence of face-to-face interaction is thought to help patients project their feelings and transference more easily. So here is the process involved of psychoanalytic therapy: establishing a therapeutic relationship, free association, dream analysis, exploration of resistance, where you identify, like we have previously were discussing about the defense mechanism which Freud has given, like projection, repression and all. So that understanding and identifying, we are working along that defense mechanism. Transference, examining the patient's feelings towards important figures in their life and how they relate to the therapist. Working through all the identification we have done in exploration of resistance, transference and in dream analysis. Then moving on to interpretation, often insights and connection to help the patient understand their unconscious motivation, catharsis and termination. These are the few techniques in psychoanalysis. One of them is free association. Patient expresses thoughts without censorship. Dream analysis, interpreting dream to understand unconscious desires. We are going to analyze dream into two aspects. One is manifest content and the latent content. Later on, transference. So patient projects feelings onto the therapist. Interpretation, therapist helps the patient gain insight into conflicts. Here we end classical psychoanalysis, which is given by Freud. Hope you all this classical psychoanalysis will help you out to know the technique, therapeutic goal, everything, so that this therapy will help the individual to overcome the challenges and trauma, conflicts which they have embedded unconsciously throughout childhood and still suffering in the current scenario. Thank you all.